Alrighty. All right, I am just checking here and making sure we are live. I see us on YouTube. I just want to make sure we are there on Facebook. I'll give it a refresh. All right, awesome. I see us. We are live and people are joining. Wonderful. Hello, everyone, and welcome back to day 3 of the Boys Town Pediatrics Newborn Week. My name is Gabby. I have been your host for the week, and we have gone live every single day with a Boys Town pediatrician on a topic pertaining to you and your newborn. And we are fortunate today to have Mackenzie Taylor from Tender Touch Lactation Services on here today to talk about a topic that is always one of our most popular, and that is feeding your baby. So whether you plan on breastfeeding or combo feeding, formula feeding, we're going to be talking all about feeding today. And if you have any questions for Mackenzie as we go through our discussion, you can leave them in the comment section below, and we will save time at the end for our Q&A. Make sure you like this video and leave a comment or send us a private DM, maybe if you're early in your pregnancy and you don't want to leave a public comment, and we'll count that for our giveaway here at the end. We are giving away a musical learning book and signed book from our friends at Boys Town Common Sense Parenting. So when we talk about feeding and with our awesome lactation consultant we have on today, I want to remind everyone we do have lactation consultants at Boys Town Pediatrics and in our clinics, and also several across Omaha. So we are really lucky to be in an area with so much help when it comes to feeding. And so if you're watching this and you're a little nervous about feeding, just know there's several in the community that can help you, like Mackenzie. Mackenzie, how are you doing today?
Hello, thanks for having me. I'm doing really well. Thank you. I'm excited to be here.
Yeah, it's so great to have you on. Tell us more about yourself and your role as a lactation consultant.
Yeah, you got it. So my name is Mackenzie. I'm born and raised in Omaha. I have 3 kiddos, all that each have their own breastfeeding issues, which has prompted me to become a lactation consultant. I got my bachelor's in maternal child health, which allowed me to sit for that IBCLC exam in 2013. I have had inpatient experience in the hospital as well as working in a clinic. And then I started Tender Touch about 2 years ago, actually this past October, because I really felt that we needed more in-home private practice care. And in the last year and a half, we do have so many more. So there are a lot more resources now too in Omaha. But I love lactation because it doesn't feel like a job. It feels like just a mom helping another mom. And it's very, very rewarding to be a part of such a special time in your parenting journey.
Yeah, awesome. Well, thank you so much for joining us.
Yeah.
And as I said in the beginning, feeding can be a challenge for new parents those first few weeks. Mm-hmm. What do you wish all parents knew from day one?
Well, a couple things actually. One, everything is figure outable. And two, in the beginning, we're just trying to figure each other out. You're trying to figure out how to be a mom, and somehow they let you go home with this baby from the hospital, and that baby doesn't have an instruction manual, unfortunately. That would be really awesome if they came out holding those. That would be the main thing, is that everything is figure outable. Like when you're in the thick of it, it's hard to see that there's a solution. The other thing is breastfeeding is not supposed to hurt. It is common. It is about 90% of what I see is moms having pain, but it's not supposed to be that way. So if somebody says, well, it looks good, but it doesn't feel good, how it looks doesn't matter. And then it's really important to reach out to a provider, either through the clinic or another private practice LC, to get help.
Mm-hmm. Yeah, definitely very important. And we'll kind of dive into that more. So keep watching. Okay, so starting with latching, how can parents tell if baby is latching well and getting enough milk?
Yeah, that's a great question. That's the number one question, really, is how do I know if I'm doing it right? As far as latching, how do you know if you're getting a good latch? One, is it comfortable? 2 is baby seeming satisfied after feeds. Believe it or not, a good latch equals baby is getting more milk quicker, and so therefore they should be satisfied more. I do have a prop, so I'm going to bring that out. So ideally, what a good latch is going to look like is that your baby is taking more of the bottom of the areola than the top, and your nipple is there at the roof of the mouth. When your baby is like this, that's where we get that pinching pain and it's uncomfortable. And if your baby is taking more of the top than the bottom, that's also going to be pinchy because they're going to do this and then cut off the flow. So what we're looking for is that they're nice deep on there, like a wide open mouth, like a yawn, and then the nipples aim towards the roof of the mouth. That's going to be the most comfortable spot for you, and they're going to get the most milk. And then how to know, are they getting milk? We're going to watch for those swallows. A lot of times we can hear them, and that sounds like a but if you can't hear it, we're going to watch their little double chin. When they're just sucking, their chin goes like this pretty quickly. And then when they're swallowing, their chin drops down, like that towards the chest wall. So you're going to see those longer, drawn out pulls. And you might see suck, 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 swallow, pause. That's normal. But if you see these, then we know that our baby is swallowing. If they come off on their own, that's a good indicator that they got enough. And as far as latch goes, if your baby comes off and your nipple looks just as round, great, it was a good latch. If it was smushed in any way, like pinched like a pancake or looks like the tip of a lipstick, then we know we need to adjust the latch a little bit.
And how do you go about adjusting the latch?
Great question. So in a perfect world, your baby gets on there perfectly, right? But I don't see moms when everything is going great. So to start the latch out, when your baby goes to get on, my baby here, you want to line your baby up with their nose across from your nipple, because we want them to lean their head back to open wide and then aim that nipple towards the roof. Sometimes though, our babies are so sleepy and they don't open wide. And we're like, well, how can we physically get our baby to open wider? You could come in closer with your hand, press your breast, and then point your nipple up. So then even if they're giving you these little lips, you're forcing them to get all that tissue. We want to teach them it's breastfeeding, not nipple feeding. Nipple feeding hurts. Now, let's say they're on there and you're like, well, I think it looks okay, but it's still kind of pinchy. While they're sucking, if you can reach in there or have your partner reach in there and just pull that chin down so they get that wide open mouth, then you're going to notice that feeling of, okay, that pinching is gone, they're deeper on, and it feels like somebody is on your nipple, but there's no discomfort.
Mm-hmm. Yeah. Wow, having that visual really helps, because it's one thing to explain it, but to be able to show the angles.
Props, my friend, you got to have props.
Yes, thank you for bringing those on.
Yeah.
So we talked a little bit in the beginning of some might find breastfeeding to be a little bit painful. What are some other challenges that parents might face, and how can we address them early on?
Yeah, so pain, yes, is the number one. And then 2, milk supply. How do I know if I have enough milk? How do I know if my baby is getting enough in the moment? How do I know what's in my breast is getting to my baby? If we had ounce markers on our breast and ounce markers on the baby's tummy, it'd be super helpful. Unfortunately, we didn't come with those. So how you know you're getting enough milk? Well, one, in the early days, you're going to have multiple weight checks with your pediatrician. Usually you have one the day after you discharge from the hospital, and we see our babies lose a little bit of weight. That's normal. After they're born, they can lose up to 10%. And then we want to monitor that weight. And so at 2 weeks, we see them back to birth weight. If they're not back to birth weight by 2 weeks, okay, then we're checking in on where your milk supply is at. So do your breasts feel full before feeds and then softer after? That's a good indication that their baby is removing milk. And if then their weight gain is good, that's a good indication that you have good milk supply. We're also going to count potty and poopy diapers. We want to see that, especially if you're just doing breast milk, we want to see that poop turn from that tarry meconium stuff in the hospital to dark brown, and then it's yellow. It looks like watered down mustard. That's normal breast milk poop, and that's a good indicator if you're getting frequency, 4 to 6 of those in a day, then okay, yes, I've got good milk supply. That's why we do so many visits in the early days, to make sure that you're getting off on the right foot and that we can strategize. It's also not a bad idea to have a prenatal appointment or take a prenatal class, because that will help you determine, okay, what are my risk factors, if any, and what do I need to do to keep an eye on things to make sure that my milk supply is good. So those would be some things. Potty, poopy diapers. Is my breast softer after feeding? And how's the weight gain? Then we can know our milk supply is sufficient. Often at lactation visits, we'll have a baby scale. We'll weigh the baby before and after so we can see what your baby is getting from your breast so you can get that peace of mind. Because again, we don't have those ounce markers, which would be so helpful.
Yeah. I was going to ask you, do you recommend people do the weighing method before and after, or do you think it adds a little bit too much?
It depends. Okay. So we have a lot of anxiety already. Sometimes doing all that weights can cause more anxiety. But I think if you do it in the realm of a lactation appointment where somebody's bringing you a scale rather than you buying a scale and then having it there that you want to weigh all the feeds, doing weighted feeds here and there are fine. You do not need to do them around the clock because, yes, that can cause anxiety. And another thing is that babies, when they breastfeed, they take different amounts each feed. Sometimes they have snacks and sometimes they have Thanksgiving dinner, just like me and you. They don't have the same amount every time when they breastfeed. And so you could do weighted feeds all day long and they're going to get something different each feed. But that 24 hours, that overall weight gain that we see, tells us they're getting what they need to in 24 hours. So weighted feeds are great if we need them, but I would not do them around the clock because correct, that can cause more anxiety.
Yeah. Perfect. So when you were showing the latch, I had some thoughts too, thinking about a lot of women will need to use a nipple cream or will sometimes have bleeding from feeding. Why is that caused?
Well, sometimes with the latch technique, if the latch isn't quite right, and it takes one latch, one wonky latch or two, and we can have cracked bleeding nipples, we can have scabbing, blisters. I helped a mom last night, only 36 hours in, and already had bleeding and blistering nipples, but the latch wasn't quite right. So when the latch is good, we should avoid nipple damage. Now, the skin on our the skin on our nipples is thin, and so you get dry weather and all of that, and our nipples aren't used to having a baby on them every couple of hours. And so we can see that cracking even when the latch is perfect. So using the nipple cream as a moisturizer or coconut oil, those kinds of things can be very helpful as a preventative. But then if you have wounds on your nipples, we're talking scabs, bleeding, anything like that, the one, I would want you to call a lactation consultant because we want to see what's going on. And then two, there are antibiotic ointments that exist that you're going to go with the guidance of your OB or your lactation consultant, depending on what is going on. But 9 times out of 10, it's positioning or latch technique that needs to be adjusted that causes those wounds.
Mm-hmm. Do you recommend the nipple shields?
Yeah, nipple shields can be very helpful. I think it's a great tool. I say it's a temporary tool, and how long you use it just depends on your situation. The whole reason the nipple shield was created was to be a barrier to pain. But we can use it for lots of things. So if mom does have bleeding nipples, she can use that to latch, so then it takes the edge off a little bit. If a baby has only ever gotten a bottle and now we're transitioning to the breast, using the nipple shield kind of tricks the baby and latching onto the breast. It's a different feeling. And then the nipple shield can also be used if you have flat or inverted nipples, or if you have a preemie baby that just needs a little bit more help. It can be a great training wheel for them. And then we work on weaning it later once we feel like everything is established.
Yeah, great. So you mentioned positions. Are there any positions or techniques that work really well the first few weeks of breastfeeding?
Yeah, absolutely. So you can do really whatever position is comfortable, but in the early days when you're trying to figure each other out, my favorites are the football position and the cross cradle. I'm going to scoop out so you can see a little bit, give you a little angle here. So the cross cradle essentially is if you're nursing on your left breast, and this might be different since we're mirrored, but if you're nursing on your left breast, your left hand is going to be holding your breast, your right arm is holding your baby. You're controlling both your breast and your baby, one in each hand. So this is the cross cradle, okay? So then you can come in, compress, you can aim that nipple up, kind of we talked about making sure your baby's getting deep on there, and then they're in a good rhythm. Now, if you're comfortable and we're going and nothing's hurting, you can bring this arm over, but I would start out this way. Now, the football is similar in that we're just going to switch to the right. If you're nursing on your right side, your baby's in your right arm, you're tucked in like a football, and then you're holding your breast here. So again, you have control of your breast with one hand and control of baby with the other. And then yes, if they're going and you're comfortable and you're not having pain, you can rest your arm elsewhere. But these two are really good for those first couple of weeks while you're still trying to figure each other out and make sure that everything is fitting together like a puzzle piece.
Yeah. And then beyond those first few weeks, do you have other positions that work great?
All of them, any of them. Yes. So another one, and this one is a pretty popular one. It's called the cradle hold. Essentially, you're cradling your baby in the crook of your arm here. This, I want to show you why it's difficult to do in the first couple of days, because if you're trying to latch your baby, it's hard to, I'm going to do it this way. It's hard to latch with an elbow.
Right. Okay.
So that's why we say do this initially. But once your baby's on there and this is great, because then you have that hand free. You can take a sip of water, eat a snack, take a selfie, whatever you want to do while you're nursing in that cradle hold. You can do side lying, and that's, basically you're lying on your bed with your baby side lying. I would make sure that we're making sure we're not falling asleep and all of that. We can talk safe strategies. That's another great reason to have a lactation consultant, because if they come into your home, they can show you how to do that safely. Side lying is great. We have reclining, where you're basically, sorry, I'm going to move my computer again. You're basically latched across cradle to cradle, and you're just reclining back. This is great if you feel like your flow is really fast. This helps your baby control the flow. And then as your kid gets bigger, they're going to be doing all kinds of positions. You're going to have feet in your face. You're going to have, my interns kid picks her nose.
Oh, they reach up and.
Yeah, all the things. They can play with your hair. And so as they get bigger and it's not such a two-handed job, position techniques don't matter as much, because they've already figured it out based on your hard work in those early days.
Yeah. Awesome. Great. Well, thank you for showing those. I see some questions coming through in the comments. So
great.
Thanks, everyone. We will save those for our Q&A at the end. And we're going to jump in and talk more about formula feeding and combo feeding. So for parents that are using formula, what are some key tips for safe preparation and feeding?
Yeah. So with formula, you want to make sure you're following the instructions to a T on the can of formula, whether you're using ready to feed formula or you're using powder. And another key thing is wash everything. Your hands first, bottles, nipples, everything need to be washed. It's not sterile, so we want to make sure we wash. And then if you're preparing the formula with powder and water, you want to make sure that your water source is safe. A lot of formulas, the powder formulas, want you to boil your water first, let it cool, and then mix it. So again, following those instructions to a T, because we want to make sure that what we're doing is safe water with that formula. And then when you prepare it, you need to use it within 2 hours or refrigerate it immediately, and then use it within 24 hours if it's refrigerated. You never want to reheat formula, because when babies drink from the bottle, their saliva goes into the bottle, including that bacteria that's in their saliva. And if we reheat, we're just going to see that bacteria grow. So we don't reheat bottles. If they don't finish it, then you got to toss it. If you're struggling to figure out, the instructions with your formula, again, check the back of the can or the bottle. And then the CDC also has really good recommendations for formula preparation. That's a really good resource to check out also. If you're doing some breastfeeding and some formula for whatever reason, sometimes we don't have enough milk. That's okay. And sometimes we need to give our baby formula. There's nothing wrong with that. Yeah. If you're topping your baby off with formula after breastfeed, again, that's going to be follow the instructions on the can. Mm-hmm. If you're exclusively pumping and you're providing breast milk in a bottle and then formula on top of that for, to add to whatever milk supply deficit you may have. If you're going to do that, we want to follow the instructions with the formula first. So if you're mixing powdered formula with water, you want to mix it with the water first. And you can combine with your breast milk if you want, but then you have to follow the formula guidelines on if you don't finish it, it has to be tossed. So if it's painful for you to toss your breast milk, feed your baby the bottle of breast milk first, and then whatever separately in a bottle of formula. So then you can keep those guidelines a little bit separate. So you can do that. Anything beyond that, if we're adding formula to breast milk beyond what I just described, we definitely want to do it under the guidance of your pediatrician, depending on the why as to why we are providing that formula and breast milk. And some kids just need a little extra. So I always defer back to the pediatrician if there's something beyond what the can says.
Yes, definitely. And you mentioned pumping, so I'd love to talk about that. How do we decide when to pump, how much to pump? Should we pump? What do you think?
Yeah, so many questions, right? Feeding your kid is lots of questions. So with pumping, it depends. If you're going back to work, then usually I say halfway through maternity leave allows you time, that first half of your maternity life, to get used to breastfeeding and settle into being a parent, or you just kind of get into the rhythm, have some recovery time. And then halfway through maternity leave, if you haven't pumped then that's a good time to start. You don't need to have a freezer full of milk for your first day back at work. Really, a day or two worth of milk in the freezer is all you need. And so let's say your maternity leave is 12 weeks. We're going to start at 6 weeks if you haven't done any before. And then you're going to pump maybe 1 to 3 times a day. And it's going to be after feeds. So your baby gets first dibs. You're pumping the leftovers. And then that's what you store up for your first day of work. If you're exclusively pumping, well, you're pumping immediately after delivery. And we're going to pump every 2-3 hours, which is about as often as a baby needs to eat. If you're staying home and you're like, well, I don't really need to pump for work, but I would like to go to Target by myself, or maybe dad takes overnight feeds. What does that look like? Well, then you're going to pump in place of those feeds. So if dad's giving the bottle, you're going to pump to make sure we tell your body that you still need that milk, and then you have that milk for next time. So it just really depends on what the need is for pumping. Sometimes in the early days, if our baby is really sleepy, or let's say we do have those cracked bleeding nipples and we need to take a break, you can use the pump at that time to pump and give your baby a bottle to give yourself that nipple rest. When I say halfway through maternity leave, that doesn't mean you can't pump until then. It just means if you haven't, that's a good place to start. Certainly anytime where you feel like you need a break, or you want somebody else to feed, or your nipples need a rest, you can certainly pump. The thing with pumping is that we also don't want that to hurt too. So if pumping's uncomfortable, we want to turn the suction down. More suction does not mean more milk. And then we want to make sure that you're in the right flange size, and that's the piece of the pump that touches your nipple. And again, lactation consultant in the hospital and or once you're home can measure you to make sure you're in the right size, and then make sure you know how to use your pump and how to clean the parts and pieces.
Yes, awesome. Thank you for covering that.
Yeah, you bet.
We've got a few more questions on our list, and then we'll jump into the Q&A. So if you have a question on feeding, go ahead and leave it in the comment section now. And of course, if you're watching this video later tonight, or maybe after work the next few days, you can always still leave a comment or message our page, and I can share it with Mackenzie to help get your question answered. How often should newborns feed, and how can parents know if they're getting enough?
Mm-hmm. So an average babies who are breastfed specifically, and in the early days, it's going to be breastfed or formula fed. They typically eat 8 to 12 times in a 24-hour period. Now that averages to be every 2 to 3 hours. Some will have chunks of time where they eat every hour, and some may give you a 4-hour stretch. As long as we're hitting at least 8 times in 24 hours, we're good. And we see that weight, those weight checks, we see that weight going up, then you should be okay there. And then, so it is going to feel like in the early days that all you're doing is sitting and feeding your baby. You're right. That's the only thing that you have to do right now is feed your baby. Okay. And then how to know if your baby is getting enough. We're going to go back to that, the poop, has it changed to that yellow if you're breastfeeding? If you're doing some formula, you might have a green or a brown looking poop. And then potty too. Are we getting plenty of potty diapers? Are they coming off the breast satisfied? Or are they coming off the bottle satisfied? Are they meeting their weight checks? Again, they drop up to 10% of their body weight of their birth weight after discharge. And then we want to see them back to birth weight by 2 weeks. So if we're hitting those marks, then that's a good indicator that they're getting enough. Same with if we're breastfeeding, our breasts feel full before, softer after. They come off on their own is a really good sign. Now, some babies will stay latched 24/7 happily. So in a perfect world, they come off when they're done, but my children didn't do that. Like they'd still be latched if I didn't take them off. So what we're going to look for is body language. When they're still hungry, their fists are going to be tightly clenched like this and probably up close to their face. As their little bellies get full, their hands kind of release. They get really, you can lift the arm up and it just drops. Those are good indicators that your baby has a full belly, and then you can take them off. Now, you can certainly keep them on latching if they're just giving you those little comfort sucks and you're enjoying whatever Netflix show you're binging. You can keep them on there. That's fine. But if you don't see those swallows anymore, they've been on there for 15 minutes, they're passed out, you can do the arm test. They don't have to stay on there. You can take them off and just get that skin-to-skin snuggle time.
Yeah, perfect. Oh, I love it. It just goes by too fast. So
It does.
Oh, I love it. I don't have this on my list, but I was thinking about it. So much we talk about with feeding is the lactating parent. Mm-hmm. I know that there's parents watching, there's grandparents watching, there's other caregivers watching who want to know, how can I support the lactating parent during this journey?
Thank you for asking. That's a big one. Because sometimes the partner, if you have a male partner, their nipples are useless. They're just for decoration, really. And so they often too find, what can I do? Or even grandma or neighbor or friend or whatever, what can I do? The best things you can do is make sure mom has snacks that she can eat one-handed. Something with protein because she needs energy. Make sure her water bottle is always full. When you go over, we know you want to go over and see the baby, and that's very helpful, but she also needs you to do the dishes or bring a meal over or throw a load of laundry in. She may not ask for that help because often we just feel like we want to do it like I'm a do it myself kind of person. But something that I found helpful is have mom put a list up on the fridge, or mom put a list up on the fridge. These are things I'm willing for other people to do. So then when you do go over and visit, you can pick the thing you're going to commit to, whether it's walk the dog, throw a load of laundry in, or do the dishes. Again, food, snacks, one-handed items. If she had a C-section, maybe help getting her to those pediatric appointments if her partner's back at work or she's single mom in it. So those kinds of things, because you can't drive for 2 weeks after a C-section. So those things that feel little are actually really, really big in her world. Or do hold the baby and encourage her to take a shower, because Lord knows it's hard to fit that shower in when you're a new mom. And we also forget to eat. So again, snacks, water, breaks, and then some household chores, I think is the best way that you can support. And let her know she's doing a good job. We'll all often think, am I doing it right? Am I not doing it right? We're constantly second guessing ourselves. And so just letting us know, you don't have to offer a solution to what's going on. Just let us know that we're doing a good job and that you're there for us. And then here's a snack. Like, that's what we want to hear.
Yes, definitely.
Great question. I'm so glad you asked that.
Yeah, of course. So what advice or resources would you recommend for parents who might be struggling with feeding, especially in the first few weeks?
Yeah, absolutely. So really, you touched on this when we first got started here, is we have such a great community of lactation professionals in Omaha. We do have options, whether that's you're going into a clinic or you're going to your pediatric clinic or you're going back to the hospital because you fell in love with the lactation there. We also have quite a few handful of now private practice that come to your home, and most are in network with insurance, which, hello, that's awesome. And so honestly, your hospital should give you in your discharge paperwork a list of lactation professionals. I'm pretty sure all that do deliveries do that now. So there should be a list there, but you can Google in-home or Omaha lactation consultant. You're going to get a nice list. Your pediatrician also is a really good place to start because they have lactation professionals. They have the list also that they can recommend who to see. And then finding a support group is super helpful. There's quite a few of those out there too. So even if breastfeeding is going well, you just need to get out of the house and talk to other nursing moms. It can feel very isolating being a new parent. So finding yourself a support group, but really utilizing your pediatrician to muddle through the resources and see, okay, who's in network, who isn't, who's available, who does in-home, who doesn't. I'm happy to help too. I'm not in network with everybody, but if I'm on vacation or I'm busy, then I know who in the Omaha community to refer to also. So I am not the only one person by any means, but your pediatrician will be a good resource, as well as those discharge folder they give you at the hospital.
Yes, perfect. Okay, well, thank you, Mackenzie, for explaining everything so thoroughly. We'll go ahead and jump into the Q&A here. So let's see. Okay, someone said, when's the best time to add in pumping? So you said after baby is fed, right?
Yeah, so if you know, okay, I'm going to start pumping, we want baby to have first dibs. If we pump first and then your baby goes, where your baby's getting leftovers. So we don't want baby to have leftovers. We want the pump to have leftovers. So let's say it's halfway through maternity leave, or let's say you have a wedding this weekend and you're going to be out. So you're going to pump a couple times a day and you're going to do it after feeds for 10 minutes. You don't need to do 15, 20 if your baby's already eaten. We're just catching those leftovers and then adding it up to the amount that you're needing for whatever reason you're needing it for. And you don't need to pump after every single feed. It could be a couple times a day. It just depends on what we're looking to do and why we're pumping.
Yeah, awesome. Does the size of the breast determine the difficulty or ease for breastfeeding?
Not necessarily. Specifically when it regards to milk supply, bigger breast doesn't mean more milk. I've had some oversuppliers with double A size breasts. And I've had large breasts where we make a low supply. So there's a spectrum with everything regarding breastfeeding. So size in actuality with breastfeeding does not matter. Sometimes positioning, maybe there might be some positioning techniques, but not anything that isn't figure outable. And so no, size does not matter at all with breastfeeding.
Perfect. Should mothers try to just bottle feed if both nipples are too sore and hurt too much to continue breastfeeding?
I say if your mental health is hurting, then yes. Yes. If you're like, I can't possibly do this again, or you're dreading feeds, it's time to take a pause. And yes, pumping and bottle feeding, along with having guidance with lactation consultant or OB on how we can heal those nipples up quickly and prevent infection, you certainly can. I've often come into homes where mom's like, I hate feeding, it hurts too bad. Okay, we're going to stop. We're going to pump and bottle feed, and then we're going to regroup when our nipples are healed. So absolutely 100%. Please give yourself permission to do that. You're not breaking breastfeeding by doing that. You're not a bad mother by doing that. Your sanity is very, very important. So please take breaks as you need to, and we can always come back to it.
Yes, yes, yes. What can we do to try and increase our milk supply?
Great question. So the best thing you can do for milk supply is frequency of milk removal. So if you're already removing milk that 8 to 12 times a day and we're still struggling, then I'd be asking, okay, how much does the baby take? We want to do that weighted feed so we can see what is the baby taking out, especially if you're exclusively breastfeeding, and seeing how latch is going, because if latch isn't quite right and we're leaving milk behind, then we can kind of troubleshoot from there. If you're exclusively pumping and you're pumping the 8 to 12 times a day and your supply is not quite where you want it to be, we want to make sure that your pump is working appropriately. Believe it or not, they have a shelf life. So if you have a hand-me-down pump, sometimes that suction wears out, or sometimes they're come off the line and they're not quite what they're supposed to be. There is a warranty on your pump, so we would want to check the suction, which we can do that. A lot of LCs can check the suction on your pump. And we want to make sure that the shield size you're using is appropriate. If that shield that you're putting on your nipple or the flange that you're putting on your nipple for pumping, if it's not quite the right size, can affect your milk removal, which then therefore can affect your milk supply. So we want to troubleshoot all those things first before we go, okay, what can we do? Do we add more sessions? Do we not? So if you're pumping that 8 to 12 times a day and all of those other things are going well, and we've done all those strategies, then I would schedule an appointment with a lactation consultant so we can see what is going on there. We can't make sure there isn't any medical history that's causing some of that, any hormonal imbalances. There's lots of things that can go into a low milk supply. And so really having somebody come and assess all of that with you is probably the most important piece.
Yeah, awesome. Okay, we'll do a few more here before the giveaway. So thanks everyone for commenting. Make sure you liked and commented to be included in the wheel. And if you've sent our page a private DM, we've got you included in that too. Okay, so we have a question on, is it safe to breastfeed if we have medical conditions like HBP or diabetes, or when taking medications? Would you recommend?
What was the first one? I'm sorry.
HBP or diabetes.
Okay, so HBP, are we talking high blood pressure? Is that what we're talking about?
I think that's, yeah, probably.
Okay, or diabetes. So those high blood pressure or diabetes, you can certainly breastfeed. That's not going to necessarily affect it could affect milk supply. And how it could affect milk supply is that with high blood pressure, especially if we're having it towards the end of our pregnancy, if we have it in general, we have it postpartum, it can make our milk supply come in on the later end. So typically our fuller milk starts to come in between days 3 and 5. we might see it come in day 5, 6 if we're struggling with getting our blood pressure under control. Typically, that's what we see with blood pressure effect, is how quickly that milk comes in the beginning. And that's pretty much what I see. And then with diabetes, you know, anytime we have something with hormonal, that can be an indicator for, okay, we need to watch out for low milk supply. But if it's already well managed, then typically we don't see an issue with that. And so it's just a good thing to know, and a good thing for your providers to know prenatally if that's what you're dealing with, and then making a prenatal lactation appointment, which your insurance should cover, so they can troubleshoot with you and maybe make plans to pump a little bit earlier than planned, so we have extra milk just in case. And so I'd be more like, well, let's have that plan in place before delivery, so we can make sure that you're off on the right foot. But we should be able to continue to breastfeed regardless. We're just going to troubleshoot and monitor that milk supply.
Awesome. Okay, is the 6-week guideline for introducing pumping the same for introducing a bottle if returning to work?
That's a grand question. Yes. If you have not done a bottle that first 6 weeks, yes, that's a great time. That halfway, and it doesn't have to be 6 weeks. Whatever that halfway mark is for you, it's just often 6 weeks. That's a great time to start practicing with the bottle. We don't want to start the bottle the week before you go back to work, because some babies are set in their ways, and then you don't want that stressor on top of going back to work of, oh my gosh, my baby's not eating from a bottle. What am I going to do? So yes, that's a grand question. Please, halfway through maternity leave, start practicing. And it could be you that gives the bottle. It could be your partner. It could be grandma. It doesn't matter. And it could be here and there. We want to do it maybe once a week, something, so we know that that baby is still maintaining that skill. So when you go back to work, you can rest assured that your baby is going to eat at daycare or babysitting while you're at work, and you don't have that added stress level. Certainly you can do a bottle before then. Again, if you need to take a break or whatever, that 6 week doesn't mean you can't start it until then. It just means if you haven't, that is a good point to start practicing. Absolutely.
Mm-hmm. And then they asked a follow-up question. Do you have a brand or favorite kind of bottle that you recommend?
Whatever your baby takes, actually. I like, so there are several out there that are monitored to be just like breast or marketed. It's just marketing. So honestly, the longer, narrower nipples that look anything like a breast are actually better for breastfed kids, because if you take your tongue to the roof of your mouth and go back to where your palate gets soft, way back there, that's where your baby has to try your nipple. So those longer, narrower nipples go back there, and that is more familiar. However, if you get a bunch for your baby shower, or you got a bunch of samples in the mail from your pediatrician, if you get something that's not like that and your baby takes it and takes it well, use it. Don't spend an arm and a leg on bottles. If we have a baby that's refusing a bottle, let's say we forgot, now we're introducing the bottle just a couple weeks before we go back to work. My favorite is the tapered nipples. My favorite one is Lantino. It's a purple brand, and it has a softer tapered nipple, and that usually helps if you have a bottle refuser. But in general, if you're starting that earlier, practice times, whatever they take, stick with it. You don't need to buy $30 bottles. They don't need to look like a breast. Whatever your baby takes, and most lactation consultants can help you with that too. If you get into that and you're like, my baby isn't taking this or whatever, you have more questions on bottle feeding. One main thing to remember with bottle feeding is not necessarily the kind of bottle, but how are we bottle feeding? A lot of times we bottle feed with the bottle straight up and down. And then we get to work, and they're at daycare, and they're just chug, and they're taking more than they did from the breast. So we want to do what's called paced bottle feeding. And so instead of having the bottle up and down, we're having the bottle more parallel to the ground. So the baby has to work to get the milk out, just like they do on the breast. Then they go back and forth between bottle and breast just fine. So I did want to make mention of that, because we get nervous about introducing the bottle too soon. That's why, because if the bottle's just dripping, they're going to chug it, and they're going to go to the breast, and why would I want to work, right? This makes them work for their milk just like they do at the breast. And so keep that paced bottle feeding in mind. Otherwise, whatever bottle you got, try it. And if they refuse, then you can kind of dabble in those other ones.
Mm-hmm. Perfect. Okay, we'll do one more question here, and then we'll spin the wheel. So thank you everyone for your awesome questions. The last one is, can babies be allergic to their mom's breast milk?
It's a great question. When we hear the word allergic, it's very rare that they're truly allergic. Now, they can have a sensitivity or a intolerance to, maybe you hear the term MSPI, which is milk soy protein intolerance, right? I've seen it a lot overdiagnosed, and something we can watch for. Usually that shows up between 4 and 6 weeks if we're going to see it. And if we see it, that's a really fussy baby, almost inconsolable. Usually they have an eczema skin rash on their body that doesn't it's not baby acne, it just keeps going. It doesn't get better. And then we see mucus and or blood in the stool. With those 3 things, then we're like, maybe there's something in the milk that the baby is reacting to. Not the milk itself, but something in the milk that mom is eating that maybe they're having a sensitivity to. We used to say, cut dairy out right away and cut it out forever. It's not always that. We might cut it out for a little bit, and it might not be dairy. There are other things that babies can be sensitive to. I had one mom, it was strawberries, believe it or not. But there are ways we can troubleshoot that. You don't have to do a crazy elimination diet. We keep a food diary. We kind of keep track of that. But those 3 symptoms are the main things to watch for. And also your pediatricians are going to be so well versed in that. They can actually diagnose it. I can't. I can just go, let's bring them in. Fussy baby, eczema rash, mucusy, and or bloody stools. Each of those things by themselves could be different, but we see them all together. We see them around 4 to 6 week mark. We're going to bring in the pediatrician and maybe dabble in a food diary or something like that. So it's possible they have a sensitivity to something in the milk, but not the milk itself.
Awesome. Perfect. Well, I know we covered a lot of info, so rest assured I'll be linking some resources in the comments, both from Boys Town Pediatrics. I linked it already. We've got a great page on lactation consulting. And then, of course, I will be linking Tender Touch. I know it's tagged above this video, and then we'll put in the comments. So if you have any follow-ups with Mackenzie or Boys Town Pediatrics, we are here for you. So I know, 42 minutes, but we could probably talk about feeding for over an hour. There's
all week, girl, all week.
Yes. So thanks everyone for tuning in. Okay, I'm going to go ahead and spin the wheel here for the giveaway. All right, today's winner is Stacy. Congrats, Stacy. We'll send you a message from our page for you to claim your prize. So thank you. And like I said, thanks everyone for commenting. So awesome. We will be live tomorrow again at noon with Dr. Annie Zimmer, a Boys Town pediatrician. And that one is going to be cozy and clean. So keeping your baby healthy and germ-free going into this holiday season. Germ-free, that might be a little hard, but healthy and trying to keep them on a good path as they're going into the holidays. So we'll be live then. And of course, I didn't mention this at the beginning, but we do have our in-person newborn care workshop this Saturday, November 15th at 9 a.m. So if you registered, check your email for the details. And if you haven't signed up and you still want to, there's still some spots open. So you can go ahead and sign up via the comment section below. Mackenzie, thank you so much for joining.
Thank you for having me. It was so nice to be a part of it.
Yes, of course. Thank you. And we'll see everyone tomorrow at noon. Thanks, guys.